Mr. Manish Singh, sir, what is the dosage of levofloxacin? Is okay in chronic bacterial prostatitis, whether it is 250, 500 or 750, which is better? Always start with low dose, start with 250 milligrams, take for at least 2 to 3 weeks, then repeat culture. If symptoms are okay, then 250 mg is enough, but don't increase the dosage of same antibiotic. If this is not working, you have to shift to another antibiotic and again take for 2 to 3 weeks. Then Mr. Shyam, myself Shyam, having low testosterone, can you explain Sustanon 250 mg and Tadalafil tablet? See, basically we have to know your age, Mr. Shyam. See, testosterone treatment differs with the age. See, if you are 50 plus and your testosterone is low, then taking Sustanon injections will help, because that is direct testosterone, it is a steroid. But if your age is less than 50, then we have to treat it in a different way. We have to try to improve your testosterone naturally, or we have to try to increase testosterone production in your testes. This is how we have to treat. But taking Sustanon injection is only to improve your replace your, that is called testosterone replacement therapy. And Tadalafil is for erectile dysfunction, not for testosterone. Okay, Mr. Raj Hegde, sir, also give details of arterogenic ED. Arterogenic ED means damage to the penile blood vessels, penile arteries, is called arterogenic ED. So, it is a severe form of erectile dysfunction. Again, in arterogenic ED, it can be early arterogenic and severe arterogenic ED. Early arterogenic, sometimes medication can help, sometimes shockwave therapy will help, but better with shockwave therapy. If it is severe arterogenic ED, then medications may not help. Either we have to think of shockwave therapy or penile implant. Mr. Manish Singh, I think I answered your question. Mr. Azizullah, sir, I have prostatitis for about 2 years. I have done multiple tests, ultrasound, urine culture, semen culture, all are negative. Used multiple rounds of antibiotics but no response. I have also done semen culture for after prostate massage, but this is also negative. This may be, this may be fungal or viral prostatitis or non-bacterial prostatitis. It can be different. So, now see, only thing you want to rule out is whether this is a tuberculosis related, as you asked, it can be mycoplasma related, tuberculosis related prostatitis. You can do a test at a local lab to rule out tuberculosis or mycoplasma. Even that is less, then instead of taking antibiotics, go for shockwave therapy. Whether it is bacterial, viral, the shockwave therapy will work. That will increase blood supply to the prostate and it gives very good anti-inflammatory effect. So, instead of taking multiple antibiotics, go for shockwave therapy. I think I have completed this week questions. Suppose, okay, one more question, Jagan Mohan. Circumcision surgery, after how many days you have to take bed rest? See, basically for circumcision surgery, nowadays it is very simple. It is only stapler circumcision, it takes only 5 to 10 minutes. And immediately after that you can walk back, you do not have to take any bed rest. From next day onwards you can actually start working, you can go to office. So, actually there is no need for bed rest for circumcision surgery now. If it is open circumcision surgery, then you may need 2 to 3 days bed rest, but for stapler circumcision or cosmetic circumcision or laser circumcision, you do not need any bed rest. One more, Jagan Mohan. Sir, please tell me any penile implant coverage for insurance. Generally, penile implant surgery is not covered under insurance. Jagan Mohan, if varicocele surgery has to be done after recurrence, coming varicocele, okay, recurrent varicocele, how many years after varicocele coming to testis? What is main reason for varicocele? See, main reason for varicocele is genetic. So, generally either your one of your parent or some grandparents should be having either varicose veins or varicocele. That is the reason for varicocele. So generally recurrence will come after 8 to 10 years, and even if it comes, not all patients need surgery. In some patients they may get only mild varicocele after 8 to 10 years. Some patients may get severe varicocele. If there is any pain, severe pain, then only we have to do repeated recurrence varicocele surgery. Otherwise, it's not necessary. So what is best penile implant? If in case varicocele surgery has to be done after penile implant surgery, is there any impact or infection? Okay. See, generally once penile implant surgery settles down after 1 month or 1.5 months, once penile implant is okay, then you can actually do varicocele surgery. There is no problem. Only thing is, every time putting a catheter, urine tube, is risky. So generally what we do is, we will try to avoid putting urine tube for other surgeries. So if you can avoid urine tube at the time of varicocele surgery, that is much better. So we can do varicocele, any surgery, any scrotal surgery after penile implant. You don't have to worry. Mr. Rohit, what is maximum number of shock wave can a man get in his wife? See, shock waves, see, if you undergo one shock wave therapy session, then again after 2 years or 3 years you can undergo shock wave therapy. It depends. For diabetics, generally we give every 3 years we give shock wave therapy. There is no limitation. Fluoxetine long time using for 2 to 3 years, will it affect sperm production and libido? No, why you have to use fluoxetine? See, for fluoxetine, if you are using fluoxetine for premature ejaculation, generally 2 to 3 months is enough. You don't have to use it after that. But if you are using fluoxetine for psychological reasons or anxiety disorder, then long term it may affect sperm production, but you don't have to worry. Okay, one more question. Can we take half tablet of avenafil 100 mg? What is first maximum time erectile penis after taking 100 milligrams of tablet? See, generally prescribed dosage for avenafil is 100 milligrams and 200 milligrams. So for some people with very mild ED, even 50 milligrams may work. Like tadalafil, how we are using 5 milligrams, 2.5 milligrams. So if you have mild ED, you can take half a tablet. You can take 50 mg and see. If you are getting good erections, then it's okay. If you are not getting good erection, then take 100 milligrams. I think this week we have completed all the questions. Okay, if I miss any question, please post it again. Please don't think, please post it again in the new video. Thank you, viewers.